Hello and welcome. I'm Tomas Eridani and this is Story Scanner, the stories everybody's talking about in a way nobody is. A podcast based on the stories headlining Via Sarfatti 25, the magazine from Bocconi University, with analysis and insights from Bocconi professors and researchers on the big topics in business, management, data science and politics. In this episode, we're going to talk about the COVID pandemic, but with an eye to the future, looking at what we have learned, the role of research, and how we can be better equipped to face future pandemics. COVID is proving to be the worst infectious disease that has affected humanity over the past century, with reported deaths exceeding 4.5 million worldwide, and has also caused, and still is, dramatic derangements of healthcare, the economy, businesses, schooling, and many more aspects of our society. But there is now some light at the end of the tunnel as we benefit, thanks to research, from a greater understanding of how the virus is transmitted and from the growing number of vaccines and improved models of care and treatment. But since it is highly likely we will experience further such events through the 21st century, we need to understand and diagnose what went wrong, and especially analyse how policies, governance, institutions and practices can be organised accordingly to better face future threats. To look on a global scale at what could be learned from the pandemic and rethink policy priorities, the World Health Organization Regional Office for Europe set up the Pan-European Commission on Health and Sustainable Development, chaired by Mario Monti, president of Bocconi, with Aleksandra Torbica, director of CERGAS Bocconi, in the role of special advisor. Last September, the Commission presented its report, Drawing the Light from the Pandemic, a new strategy for health and sustainable development, containing a series of indications and recommendations for governments worldwide. Professor Torbica tells us more about some of the main findings and recommendations of the Commission.
The pandemic that brought an unprecedented challenge to the world inspired several commissions, panels, expert groups who were formed in search of solutions. The Pan-European Commission on Health and Sustainable Development, endorsed by the WHO Europe, was rather unique. This commission didn't focus on pandemic only, but health more broadly, and aimed to explore the link between health and sustainable development, in order to provide insights to policymakers to rethink policy priorities in the light of pandemics. With this crisis, it is very clear to everyone that health matters. But what seems obvious to many may not be taken for granted when we think about policymaking. The Commission's final report provides a series of actionable, evidence-informed policy recommendations to achieve 7 key objectives that can help build truly sustainable health and development systems once the COVID-19 pandemic has receded. One overarching idea underpins all of the report's recommendations. We need to change the way we think about health. The spread of coronavirus happened, like so many emerging infectious diseases, at the interface between the human, animals, and the natural environment, place where the concept of One Health resides. Yet, our responses continue to inhabit silos, with physicians, vets, and colleges living in separate communities, speaking different languages. We need to bring them together. Much progress has been made in fostering collaboration between the UN agencies involved, WHO, the Food and Agriculture Organization, the World Animal Health Organization, and UN Environment Programme. But much more needs to be done at the national and local levels as well. Furthermore, we must take actions at all levels of societies to heal the divisions exacerbated by the pandemic. The pandemic has shone the light on the fractures that existed in our societies even before. Yet, these problems have been invisible because we simply failed to collect the data. An essential component of national resilience must be to fix the social safety net that have been torn asunder. The Commission sets a series of recommendations to countries how to support innovation for better One Health policies, how to invest in strong, resilient, and inclusive national health systems and create an enabling environment to promote investment in health. The crucial paradigm shift is to bring closer than ever before health policies with other government policies, namely economic and financial ones, traditionally considered more relevant for the heads of the government. It is really important for the public opinion, for the governments, to be fully aware of the total cost of this pandemic, not just the tragic human losses in the first place, but the global economic cost. And then also in case of future global health crisis. This lesson must be better understood by any future government on how they have to deal with health policy at the appropriate moment.
To achieve such aims, Professor Torbica believes that changes will also be required to the global governance of health.
None of this will be possible without changes to the global governance of health. The Commission's report makes several recommendations that include a global health and finance board to be established under the auspices of the G20 in order to promote a better assessment of the social, economic, and financial consequences of health-related risks, drawing on insights from experience with the Network for Greening the Financial System, the Financial Stability Board, and other climate and biodiversity initiatives, and to scale up private finance for health. Another suggestion is a pandemic treaty, as agreed, that is truly global, that enables compliance, has sufficient flexibility, and entails inventive mechanisms that encourage governments to pool some sovereign decision-making for policy-making areas. And finally, a global pandemic vaccine policy to be developed that sets out the rights and responsibilities of all concerned to ensure the availability and distribution of vaccines across the globe. This pandemic has undeniably confirmed the notion that disease knows no borders, geographical or political. When it comes to health emergencies, our destinies are intertwined. We need a multilateral, rule-based system in which everyone recognizes their interdependence that goes beyond political and economic strings. We cannot achieve a resilient Europe without solidarity and better cooperation in the whole pan-European region and beyond. Will any of this actually happen? Too often we have seen political attention goes away once the worst of the crisis is over. Yet maybe this time it is different. The doors are opening. The fight for health has spread beyond the borders of the healthcare systems. The aim is to reap the benefits of this extraordinary movement and make the effects of the shock lasting on our ability to remember the lessons learned.
In the last 18 months, research on COVID-19 has been a frontline field for scholars across universities and research centres around the globe. Bocconi was especially committed, creating already in May 2020 the COVID Crisis Lab, directed by Alessia Melegaro, a multidisciplinary research unit that has involved all Bocconi departments and research centres, with the aim of understanding the spread of COVID-19 and analyse its numerous implications on the health of populations, healthcare, society, the economy and finance, as well as legal consequences, and helping analyse and design efficient policies for policymakers engaged in making important decisions for the lives of citizens and nations. We are joined by Jérôme Adda, Dean for Research at Bocconi. He tells us more about why research and science have had such an important role in the last 18 months.
Yes, so indeed, this is a major crisis, an epidemiological one and a health crisis, of course. But also, I think it's also, remarkably, it's also an economic crisis. So if we think about the past pandemics we've seen over the century, for instance, with the Spanish flu, and then we also had other epidemics in the 50s and the 60s. These were major public health crises with millions of deaths. But the COVID crisis has the fact that many countries also essentially put in economic incentives or packages. And there was a major disruption of the economic life of countries. So this is like a double crisis we had to deal with. And in that aspect, it's really important to understand all the issues about this crisis. So on the epidemiological side, of course, because this is a new virus, a new instance that we knew very little about in the first place. But it also became a major economic crisis with people confined in their homes, people not preventing to go to work, and we had to essentially digitalize the whole economy in just a few weeks. And that was a first in history. And so there are many issues and many angles to this crisis that research has to answer, not just on the efficiency of public health measures, but also on what happens to the economy, how do you essentially keep an economy alive even though closed up, how do you reorganize production, how do you essentially make sure that inequality or poverty doesn't explode during that period of time. So there was many aspects of that crisis, including also education. How do we educate young children if they can't get to school? How do you educate children if they have masks all the time? And so there were so many unknowns in this crisis that this is just a new avenue of research and questions that no one really had ever thought about.
In some of his studies, Professor Adda has looked into the cost-effectiveness analysis of public policies during COVID-19 and other epidemics, looking at social distancing, school closures, testing, protective measures and other aspects. He tells us more about what we can learn looking forward.
So, yes, indeed. But first, I just want to emphasize where I'm coming from. So I'm both trained in economics and in public health and biology. And so my research is essentially trying to combine those inputs. And as I said before, the COVID crisis is important because it essentially joins a public health crisis with an economic crisis. And what we need to understand then are not only how efficient are some measures like closing down a school, which we may have some ideas of, but it's interesting also to know the efficiency of that, but also what's the costs. And not only the cost, but the cost may vary also with how long you close down schools. It may vary also with how dangerous the virus or disease can be. So in some instances, it may be very important to close down schools if it's extremely virulent, if the disease is deadly and so on. And in other cases, it may not be that important if we think of not COVID perhaps, but maybe gastroenteritis or some other disease like that, which may not kill a lot of people. So in those cases, it may not be optimal to close down school, and perhaps the best action is just to recommend people to wash hands and to be on the lookout, but we shouldn't maybe close the whole economy for that. So my research was essentially looking at that explicitly by looking at different waves of epidemics from different viruses, so mostly flu epidemics, but also gastroenteritis or, for instance, chickenpox. And I was looking at, what is the effect of closing down schools, usually by looking at the effect of school vacation, and also transportation disruption, looking at strikes in France. So I looked at the history of strikes in the transportation system over the quarter of a century to look at how that affected the dissemination of viruses. So that's one aspect of my research. The other one is trying to cost these discrepancies. So how much does a strike, a one-week strike in public transportation cost? And by combining and comparing the cost and the beneficial effect of closing down transportation from the health point of view, you can come up with a measure that says, maybe it's actually efficient in terms of economic to close down transportation, or maybe it's not. And generally, for the type of epidemics we've encountered since the 80s up to the late 2019s, that it was not really the case that you should close down schools or transportation system. COVID was entirely different, given that it was way more virulent and way more deadly. But so in these cases, my advice was to essentially implement those measures.
You can read more about these topics we have discussed and more on the latest COVID-related research from Bocconi in the new issue of Via Sarfatti 25 magazine, as well as other articles on other topics with opinion, research and insights from Bocconi professors and researchers. I'm Tommaso Ridani, and I hope you'll join me again for the next episode of Story Scanner.